You or anyone walks into the dental office with a serious toothache and you are told by the dentist you have tooth infection and you request antibiotic from the dentist. You'll be giving me antibiotics, right? Wait, what? No antibiotics? After the dentist extracts the tooth, you get painful and swollen gum the next day. You blame the dentist because this wouldn't happen if you're given antibiotics. Hello there, I'm Dr. Khan, dentist from Malaysia. In this video, we'll talk about the need of antibiotics for common infection in the mouth. I'll try to make you a bit concerned about getting antibiotics from your dentist. Antibiotics are rather amazing if you think about it more. It is just a pill that cures the infection magically. But how does it cure the infection of tooth in the mouth? Firstly, we need to know what infection we can have in our mouth before we talk about antibiotics. Infection most commonly happens to the teeth and the gums. Of course, what else do you have in your mouth? You have only two things in your mouth. And guess what? Bacteria are the main culprit that cause infection in the tooth and gums, which by the way can be treated by antibiotics because antibiotics kill bacteria. Not viruses, not fungi, not broken heart. Alright, you have tooth infection where you feel a lot of pain in the tooth, or you have gum infection where your gum is swollen and releasing pus. Then you eat the antibiotics. Now think about it. How does the antibiotics go from your stomach back into the mouth to the infection site? Well, you may have guessed it. Once it has passed your stomach, your digestive system digests it and it is absorbed into your body. To be more precise, it goes into your bloodstream throughout the body. It doesn't know where to go, so it just goes everywhere. When it reaches the site of infection in the tooth or the gums, it is showtime. It kills the bacteria and the infection is gone. It seems logical to use antibiotics whenever you have tooth infection or gum infection, right? It can kill the bacteria that cause these infections. Well, the answer is... drum roll. Not true. Let me clear up some facts for you. Most of the time, antibiotics cannot eliminate the infection in the body completely. Yes, it is also true when you're taking antibiotics for lungs infections, cough, sore throat, sinusitis, and others. Your body is a complex, dynamic, uncertain being. When you have infection in your body, your immune system will be activated to eliminate the bacteria. Antibiotics are like accessory tools used to help to fight infection. Although some antibiotics are quite specific in killing certain bacteria, but they do so without navigation. They don't have GPS. They don't know where to go, so they just get in the right in the blood and go throughout the body and kill the bacteria when they meet. So there's no guarantee that after taking a week of antibiotic, the infection will be gone for good. It is actually your body immune system which can locate and kill the bacteria, thereby ends the infection. Since your body can cure the infection by itself, why need antibiotics? Because your body needs time to prepare the immunity armies. Therefore, antibiotics are given to help destroy as much bacteria as possible to limit its spread before the body immune system kicks in. Let's get back to dental infections. There is some bad news here. Some tooth infections and gum infections do not need antibiotics at all. At all. The simple reason being the antibiotic just could not get to the bacteria. The antibiotics can only go to where the blood can reach. Well then, when is the case where infection happens in places with no blood? Before we proceed, do like this video and subscribe to us to show your support. It will mean a lot to us. You can also find us in Instagram and Facebook to see daily tips in taking care of your oral health. Or we have a website which you can sign up and enroll in any oral health courses for free, in which you'll learn about your oral health and ways to take care of it step by step. And let us get back to antibiotics. Yes, you realize I did a haircut, aren't you? First, let's talk about the use of antibiotics in toothache. We know that toothache is most probably caused by tooth decay. Oh. There are few stages of tooth decay that can cause toothache. When the decay has reached into the pulp, or the innermost part of a tooth that keeps the tooth alive, the tooth is being infected. Yes, the pulp has blood, but the antibiotics will not work here because the bacteria is hurting the tooth in the decay or in the cavity, right? So the antibiotics will not go out of the tooth into the decay. Antibiotics will also not work in dead tooth or pulpal necrosis because although bacteria is in the tooth, but there's no blood in the tooth anymore. So antibiotics will not be able to reach into the tooth to kill the bacteria. So the point is, antibiotics for initial toothache, no use. After this stage, the bacteria start going out of the tooth root into the jawbone, which can cause swelling in the jawbone known as tooth abscess. At this stage, the dentist may choose to give or not to give antibiotics, depending on the extent of the infection. Regardless, the bacteria in the tooth will have to be removed through other ways, either by removal of the tooth or root canal treatment. Sometimes the bacteria in the jawbone spread into the gums and cause swelling in the gums with or without pus discharge. The management is still the same. Antibiotics may or may not be necessary, but something has to be done to remove the bacteria from the tooth. To cite a few scientific studies from Systemic Reviews, which is a high level of scientific study, a considerable percentage of pain of dental origin originates from acute or chronic infections of pulpal origin, which necessitates operative intervention rather than antibiotics. That means most of the tooth infection need removal of decay, tooth extraction or root canal treatment, and antibiotics will not be helpful. The clinical situations that require antibiotics are limited, and they include oral infection accompanied by elevated body temperature and evidence of systemic spread such as lymphadenopathy and trismus. That means antibiotics are useful when the bacteria has gone from the tooth into the body. In the few scientific guidelines, it is said that antibiotics should be avoided in cases of pulpitis, pulpal necrosis, or dental abscess without systemic involvement, which means there's no spreading infection. Okay, gum infection is tricky to treat. The bacteria are hidden in the gum pockets and causing infection of the gums. The bacteria here is particularly difficult to remove because they are housed in the dental plaque and the tartar in the gum pocket. Antibiotics can only reach to the gums, but not the dental plaque or the tartar. Therefore, the main way of treating gum infection is to remove the plaque and tartar around the teeth by scaling and proper toothbrushing with flossing. While antibiotics will be considered to be given in more serious types of gum diseases, such as severe periodontitis, which can be quite aggressive, acute pericoronitis and acute necrotizing gum diseases. All these cases are actually of more aggressive and fast progression. So antibiotics can help in reducing the infection and the pain before a thorough cleaning of the dental plaque around the gums can be done. As informed by many scientific studies, chronic inflammatory periodontal conditions do not require routine use of antibiotics, which means the long-standing gum infection or gum inflammation generally do not require antibiotics. Systemic antimicrobials should only be used in acute periodontal conditions where drainage and debridement is impossible, where there is local spread of infection or the systemic spread has occurred. So it's quite clear it is only used in severe types of gum diseases. The use of antibiotics in moderate or severe case of periodontitis is quite vague. Some studies showed that the effect is positive, while others showed none. Most have suggested that the removal of dental plaque is the mainstay because the bacteria is in the plaque, while the use of antibiotics can be adjuvant to the treatment. That's a huge lot of information that I've given. Now I'll try to categorize them so that you can see them all at once and hopefully be clearer. The first group covers the situations where you have pain but do not need antibiotics. For tooth, it can be severe toothache without infection, dead tooth, or pulp necrosis, mild tooth infection which is not spreading out of the jawbone, or a pica periodontitis. While for gum, it can be mild periodontitis which can be just resolved by proper plaque removal, and that can be done by scaling and proper hygiene care. The second group covers the situations where you need antibiotics. For tooth, it can be tooth infection that has spread out of the jawbone to involve the face and neck. Examples are acute dental abscess, space infection, and cellulitis. Serious tooth infection that causes fever or restricted mouth opening. For gum, there are severe gum diseases like severe periodontitis, acute pericoronitis, and acute necrotizing gum diseases. Certainly, I cannot fit everything into these two groups, as there are certain situations where antibiotics should be considered in individual cases. For example, if a person with poor immunity comes with dental infection, he or she should be considered to be given antibiotics beside the main treatment approach. A patient undergone a long duration of tooth extraction may need antibiotics to prevent infection later on. Patient with certain heart valve condition may need prophylactic antibiotics or prevention antibiotics that is taken before some procedures to prevent mouth bacteria from causing infection to the heart valve, because it will be so hard to fix the heart valve if it is infected. Sometimes, if a person has swelling around the jawbone due to infection, the dentist may prescribe antibiotics before removal of that tooth, because the local anesthesia or the numbing process may not work well due to the ongoing spreading infection. In the situations where antibiotics are not given, what can be done to solve the pain? Well, the main thing to do is to remove the bacteria through other means. If the toothache is caused by tooth decay, it can be solved by tooth filling, root canal treatment, or tooth extraction. If it is gum disease, it is treated with teeth scaling to remove the plaque and tartar. Once the bacteria are removed, the body will remove the remaining infection and heal on its own. The temporary pain caused by the mild infection can be relieved by painkillers. So, should you get antibiotics if you have toothache or tooth infection? It really depends on whether the infection has spread out from the tooth and the jawbone into other parts and the body. What is more important for you to understand is that the dentist who have looked into your situation is probably the best person to decide for you. It will be up to your discussion with the dentist to decide on whether antibiotics are needed. If you think about it now, why do we care so much about antibiotics? Why don't just get them regardless of the seriousness? That is because antibiotics are not always good for you. Besides killing the bad bacteria, they also disturb the natural community of the bacteria in our body. There are side effects to antibiotics as well, such as nausea, vomiting, diarrhea, rashes, allergies, and others. And it is the concern of the scientific communities that widespread unnecessary use of antibiotics could potentially develop antibiotic resistance, which means some bacteria that survived from the antibiotics may get stronger and not being able to be killed by that antibiotics anymore, making that antibiotics useless in the future. So think about this, and I hope you at least understand that antibiotics are not magic pills which cure everything with no side effects. Hope you find this video interesting and helpful. Don't forget to give us a like and subscribe to our channel to show support so that we can make more interesting content like this one. Thank you for watching and see you again.